been following the story of a Holbrook man trapped in Fiji after falling critically ill. Despite his family's efforts to bring him back to Boston for treatment, Scott Winslow died last night overseas. As WBZ's Mike Sullivan found out, his family's struggles are not as rare as you might think.
The trip of a lifetime. That's what this was supposed to be. Sailing the waters of Fiji was breathtaking for Scott and Claire Winslow until Scott fell ill.
He could have been home by now, but everyone just pointing fingers.
He was taken to a Fiji hospital. His family saying he suffered from an infection that led to an embolism in his lung.
And then I go, well, how long are we talking? Like, is he going to survive? And I was told 1 to 2 days.
His daughters have been fighting to get him a medical evacuation to Boston since June 25th. They say his insurance provider, Aetna, told them his care was adequate, that they wouldn't pay for the flight, despite doctors' notes saying otherwise. His doctors tell us he was sharing the only dialysis machine in the hospital with other patients, and that the antibiotics they had weren't working.
The doctors wrote, the letters of medical necessity. They're saying we cannot manage him. I don't know what more we can do.
In a statement on Tuesday, Aetna said in part that they continue to work with the family and his providers in Fiji to identify the best way to get him back safely to the U.S. for treatment.
It's not their family, it's not their father, they're not in the situation.
The family says Aetna reps told them they could front the lofty medevac costs, but reimbursement was not assured.
They're willing to, reimburse, but you have to pay out of pocket, which is something we're not able to do.
So they turned to their embassy for a loan, saying representatives were willing to help, but it may take time.
I'm running in circles. For 2 weeks, I'm chasing my tail trying to get someone to help us.
Before they could find an answer, Scott passed away last night.
I don't understand how they can even write a denial letter after the letter of medical necessity from the doctors and also his medical notes.
Unfortunately, medevac companies say this happens more often than you'd think.
I wish that I could tell you that we did not run into those kinds of things, but we do.
Dan Richards is the CEO of Global Rescue. His teams have done tens of thousands of medical evacuations.
These medevac aircraft, the fixed-wing aircraft, range anywhere from usually $8,000 an hour to north of $15,000 an hour. So the numbers that I've seen, north of $200,000 to bring him back to Boston, that's not a crazy number.
He says his team would have advised a closer option if possible.
It's a judgment call and hard to know whether or not somebody might survive the transport or not.
We asked Aetna for a statement following Scott's death. They said they have nothing to add. In Boston, I'm Mike Sullivan, WBZ News.